This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. We go. Hello, everybody. Let's go ahead and open up that waiting room as we are here for you. Folks, if you would like to join us live here on Daily with Doc and Becca, you are more than welcome to do so. Make sure that you email us, Zoom or info@dailywithdoc.com and say, hey, I want to be part of your live Zoom audience. Again, that is info@dailywithdoc.com, and we will make sure that you get the link so that you can join us Wednesday, Thursday, Friday from 12 to 1 p.m. Pacific, 1 to 2 Mountain, 2 to 3 Central, and 3 to 4 Eastern Time. And if you are in South Africa, I think is it midnight till 1 right now, Albert? Or something close to it. Folks, we love the fact that we are able to reach people around the world with information that is empowering, helping you make those difficult decisions. And sometimes they're not as difficult as you think. So today on Daily with Doc, I just want to welcome each and every one of you where hope, healing, and real life transformation come together every single day. I'm your host, Becca Dukes. I'm so grateful that you are here today. And if you've ever wondered why some people take all the right supplements, eat all the right foods, follow all the right protocols, and still don't quite get where they want to be in this health journey, well, today's show is going to be a breakthrough for you. Because nutrients don't always work if they can't reach the tissues. Minerals can't repair. Vitamins can't activate. Amino acids can't rebuild. And when the body's pathways are blocked by tension, inflammation, stress, stagnation, or trauma, nothing goes the way that it should. But there's some good news. The body was designed to heal. The body was designed to heal, folks. And sometimes all it takes is opening up that flow. So today we are excited to be able to bring to you one of my friends who I met when I was working side by side with Dr. Wallach in San Diego, California, Elizabeth Pasimio. She is a licensed acupuncturist. She is also trained in Chinese, traditional Chinese medicine, herbalism. Man, she's got so much. Family wellness specialist, and she has her own clinic there in Bonita, California. But the thing that I really want people to understand is you don't have to be afraid. Because acupuncture doesn't just relieve, it restores circulation, enhances microvascular flow, it reduces stagnation, and helps nutrients get exactly where they need to go. Now, our guest today Elizabeth Pasimio. She's, as I said, a licensed acupuncturist, herbalist, family wellness specialist from the San Diego area. She has over 13 years of study and clinical practice in the traditional Chinese medicine. She has a passion for helping families, supporting women's health, and restoring balance in the mind, body, and spirit. One thing her patients love about her, and you're going to feel it today, folks, is her genuine ability to listen, not just hear, but truly listen. And she has a remarkable gift for identifying where the body's flow is blocked and how to gently open those pathways so healing can actually happen. Again, the body does the healing. As a mother and practitioner, Elizabeth has a deep understanding on how stress, tension, and daily life can restrict flow and how acupuncture can literally help the nutrients we take, the food we eat, and the supplements we rely on finally reach the tissue that need them. So today she's going to help us as we're going to be going through some questions, just an interview type style. If you do have questions that relate to today's topic, we invite you to raise your hand if you're here live with us in the Zoom. And we will get to questions at the end as time permits. But folks, please help me welcome to the screen my friend, Elizabeth. Hello, Elizabeth. Welcome to Daily with Doc and Becca. I know the last time we recorded a show, it was on my radio program, Better by the Minute Live, where I'm touched by how you help people, your heart, and all that you put into helping people as a working mom and having your own business and still having that heart for others. So thank you for joining me again today.
Thank you for having me. I'm happy to be here, Becca.
Well, is there anything about you that I missed that you would like to add to your introduction?
I love the introduction. Thank you so much. I would like to add something. I'd like to tell my story of how I was planning to become an OBGYN and that I decided I really didn't want to be the one giving medications or doing surgery. And so I had to pivot. And my two options were chiropractic or acupuncture. And I went with acupuncture, even though I love chiropractic, I went with acupuncture because it doesn't just treat the body. It also treats the mind, it treats the spirit. So I can help people with physical ailments, but I can also help them with emotional issues and even related spiritual type problems. And they're all connected, they all work together. And I feel like that's really what my emphasis is and how acupuncture is a special modality in that way to treat the way that the mind, body, and spirit interact.
So go a little deeper and let's just dive in.
Okay.
So you mentioned about, the spiritual side, the mind, body, the spirit. How is that linked to nutrition and how our body can absorb or not absorb nutrition and acupuncture?
Absolutely. So let's talk about digestion. The main organs in Chinese medicine that are related to digestion are the stomach and the spleen. In Western medicine, we don't talk about the spleen that often, or at least not in every day, not unless you're a doctor. But in Chinese medicine, the spleen is probably the most important digestive organ. And so let's see, the emotion that affects the spleen is worrying or overthinking. So when we spend our time really overthinking things, kind of fixating on stuff, it actually decreases the energy of the spleen. So digestion becomes more difficult. This is something that people don't usually know. So when they come to me, I can feel their abdomen, I feel their pulse, I look at their tongue. Those are my diagnostic tools. And then I hear about what their symptoms are. And then I can see, oh, their spleen is very tired. We call it the qi, the energy of the spleen is very low. And then I'll say, do you also tend to overthink? Do you tend to worry a lot? Oh yeah, I'm worrying all the time. And so, yes, I give nutritional advice. Yes, I give even advice about when to eat, what to eat. how you're feeling when you eat, but also all the other time of what you're doing with your mind and what you're spending your time doing. And if you're worrying, to get through to patients that it actually decreases your body's ability to digest. So then it gives another motivation of like, oh, working on my self-care and finding a way to calm my mind and find peace will help physical symptoms. That's just one
So, folks,
example.
yeah, stop worrying and find a way to find peace.
Yes.
So, you know, sometimes that is easier said than done.
Mm-hmm.
And when you do have that inflammation of the spleen, and because of the worry and everything, what is it about acupuncture that can help with what you just said?
Yeah, absolutely. So we have the spleen organ, and the way that we treat the organ is through the channel. So then I palpate the spleen channel, which happens to be up the leg. And so then I can find sensitive spots and I will palpate. There are certain points that are usually tender. And so I can confirm my diagnosis by pressing those points. I get the feedback from the patient. And then I decide whether I'm going to needle it or if I'm going to apply moxibustion, which is it's a dried herb that's pressed into a charcoal form. And I have it in a little sticker and it sticks on your body and I light it. And so they do different jobs. So I basically diagnose the channel and then I treat it that way. So sometime with the spleen specifically, it's usually a deficiency of chi. And so when I go along and it's tender and it's like an indentation, I stick a needle there. And what that tells the body is to come bring energy over here. And each of the points have functions. For example, spleen 9, it's near the knee. It's usually very tender on people, especially if they have digestive difficulty. And if I looked at their tongue and saw a very thick white coat, that means they have dampness. Now this is going to sidetrack me, but let me talk about the way Chinese medicine looks at digestion. It's like a pot of boiling water. And when we are young and healthy, it's a rolling boil. Anything you put in there, doesn't matter what kind of stuff it is, it just turns into pure energy. And children, they have great energy, they have great digestion. But over the years, we're putting in a lot of cold foods, literally temperature cold, raw foods, difficult to digest things like dairy and gluten, all of those things. And then the rolling boils more like, oh, I'm going to try to get that into energy, but it's harder for me to get it into energy. So as time goes by, it tries to make it all into energy, but instead, like a layer of sludge is kind of kept at the bottom. And we call it dampness. And then it unfortunately travels to different parts of our body. It shows up on the tongue. The reason our diagnostic tool is the tongue is because it's the only exposed muscle in the body. So it tells us the internal environment. It can go to the joints. And so you can have joint pain, usually in the lower body because dampness is heavy, but it causes pain. It can cause like a heaviness in the head, like foggy thinking. So it goes all over the body just from the digestion of eating things that your body can't handle. And so in Chinese medicine, a lot of our nutritional therapy has to do with soupy, easy to digest foods. If you've ever heard of congee, it's a Chinese term. It's an umbrella term for all of these rice porridges. So if you think about
Mhm.
rice porridge, it's almost like pre-digested food. And then, for example, if you have dampness, you add adzuki beans. If you have spleen chi, deficiency of spleen chi, you add, it's called ren. I know it in Latin and I know it in Pinyin. It's basically a grain that helps with that. Or you put in datsao, which is the red jujube dates. And so that's the food therapy that we do. Now, that doesn't mean you eat that all the time. It means when you're having a flare up of digestive issues or you're trying to heal, you make it very easy for your digestion to get the energy it needs without having to process raw veggies, raw fruit, things like protein powders, process anything really.
Recording
It's
in progress.
very difficult to process. And so let's see. And the moxa, sometimes the spleen is just tired. If it's overrun with dampness, then I have to use the moxibustion. And it's kind of like come on, let's do this. It adds warmth, it adds energy, it adds It adds the energy that it needs to get it going again. And this is why we recommend eating something warm and soupy in the morning. All of our ancestors knew that. And that's why soup was what we ate in the morning. I don't know when it turned to coffee and a pastry, but that does not help our digestion really at all. And so it's these kinds of behavior modifications and dietary guidelines that I would give to someone who came in with that spleen issue. There's, of course, there's a lot of different presentations, but this is just a general example of how we would treat that. And so again, back to the needle, it's telling the body to bring energy there and to work on the specific functions of that point, which is to clear the dampness, strengthen the spleen. We clear dampness. One of the ways is through urination. So it's actually like a way to make your body get it out through your urination. So you can, and we also have herbs that do that. So kind of explaining that whole process. That's one example for you.
Well, that's really interesting. And I know a few people that I hope they're watching this as they start their day off with coffee and pastries. Nobody in my household, of course, but there's a lot of people that do that. And that's just not setting your body up for proper digestion or that energy flow.
Mm-hmm. I actually have a specific story from myself and I think it's helps people because, like the example of a green smoothie, it's kind of said like, oh, a green smoothie is always a healthy option. So I was drinking green smoothies during acupuncture school in the morning, first thing in the morning, green smoothies. That means frozen fruit, maybe some spinach or avocado or something. And so every single morning I would drink the green smoothie. I would have cramping in my lower abdomen. I'd have to run to the restroom where I would have watery diarrhea. And then I'd feel really cold, like I can't get warm, like chill to the bone, like for the rest of the morning, and like low energy, and I just want to crawl back into bed. And so I was in school, I was in an herb class, and my teacher was talking about how we need soup. And then so I experimented, and instead I had some chicken broth. I threw in some spinach, maybe some brown rice, and I threw in 2 eggs. And then I had this kind of little soupy concoction. No cramping, no diarrhea. I felt warm. I had energy. Life-changing, absolutely life-changing. So I tell people this a lot because a lot of my patients come in ice cold. I touch their feet, I touch their abdomen, everything's ice cold. What did you have for breakfast? They say a smoothie or they say like a protein drink. And I'm like, I understand busy moms, busy people, sometimes you need a protein drink. It's better than Cheetos. But not to get, if optimally it'll be something warm, soupy in the morning. If you're having digestive issues, let's heal you. And you might decide you want to do it all the time because it just makes you feel better. It's a better start to your day.
Wow. So you mentioned having the broth and some vegetables in there and some rice. Do you have opinion on cream of wheat? Not cream of wheat. No, because that's gluten. But cream of rice.
I don't know if I know about cream of rice, but it sounds like the basic fine idea. I'm guessing there's actual cream. So as long as you don't have a dairy issue, but as soon as someone's having digestive issues, I take out dairy and gluten first. Those are the things that because think about your mucous membranes. If they are allergic to something and then you keep giving it, your body cannot digest because it's in an inflammatory response against whatever it is sensitive to. So I have people who are eating gluten or dairy or drinking beer, or they're having something that they really are allergic to. They have a consistent problem. And I'm like, we have to take it out and we have to experiment. It really requires the openness to take things out, put things back in, and hold above all else, like, I want to feel better. I'm willing to do anything to feel better, as long as you're being guided on what to do. And then you get a check-in with your acupuncturist. So like, so you didn't eat gluten this week? Did you feel an improvement? Actually, I did. That kind of thing. And they're like, okay, so is it worth it to you to not eat gluten to feel better? Like, were you able to have more energy to do your life? Actually, I really feel better. It's totally worth it. Fabulous. Nice work. What are we going to work on next?
Right.
Mm-hmm.
Well, let's talk about what we can work on next and share with us how like the stress or tension physically blocks nutrient delivery.
Yes. So, oh gosh. So stress, emotional stress, spiritual stress, that feeling of desperation, just kind of that self-talk or that negative self-talk of
Mhm.
feeling like things are really heavy, we're overwhelmed, we feel desperate, we're not meeting our deadlines, just that general feeling like of stress and tension. It's emotional, it becomes physical. There's also physical tension from actual physical work, right? Wear and tear on our bodies. But our basically our everything gets tight and restricts and constricts. And so acupuncture opens things up. And so there's a saying in Chinese medicine, I always share this. It is that I can't say it in Chinese yet. Where there's free flow of qi and blood, there is no pain. And when there is pain, there must be some type of blockage or stagnation of qi and blood. Now, it's kind of simplistic, but thankfully, acupuncture is actually pretty simple. It's all about having things flow. Now, let's talk about physical tension first. It's kind of easier. Physical tension is, let's say like in our shoulders. A lot of us have a lot of tension here in our shoulders. And so the chi can't flow. Like, what about the things that are trying to go from our heart to our mind? Whether it's, the communication, the signals, and it's getting locked up in the neck because we're tense, we're not open to change, and this is a literal bottleneck. So a lot of things happen right here. And I have people who come in, all they have is head symptoms. And I'm like, there's tension in the neck that is literally causing things to go up and then stay up. They don't have a way to travel back down. So I relieve the tension here, and it then the body can communicate with itself easier. I just had a patient come in. She said that, she has neck pain. And so when she went face down on the table, I couldn't even see her neck. I had to really help her elongate. And her neck was so short that there was a fold and a darkening on her neck. I pulled it apart, and then I started touching it, and then I started needling it. And then she got very quiet. She was crying. Like nothing else happened. She had so much locked up in this area that no one had touched, that she was like this. And then I finally opened it and then put some needles in, and all of the things that were stuck up here, they started flowing, and they also made tears flow out because it was physical and emotional tension locked up right here. So you can think about nutrition. When I say nutrition, I really mean blood, because the nutrition goes into our bodies, and our digestive system is the one that makes the blood in Chinese medicine. And so the blood is the nutritive source to all of the, we call it all of the extremities. That is what carries the nutrition. So sometimes I just use the word blood, right? Because we need the blood and the chi to move and flow the way it wants to. And if we have blockage, that's what causes the pain, whether it's physical pain or emotional pain or spiritual pain.
Yeah. And in naturopathic medicine, with the nutrition, if you have a digestive issue, is not going to absorb through the digestive system like it should to get into the blood so that you have that nutrition in the blood to flow.
Yes, absolutely. And that's why we want to identify what we might be allergic to. And it has to be empirical data, like, hey, what works for you? When do you feel good? When do you not feel good? We can try different nutritional ideas. We can try different herbal formulas, but it really has to be a feedback from the patient of being mindful, paying attention to, how do I feel? Because as you've probably noticed, a lot of people don't even know how they feel. They don't know how they
Right.
feel after they eat something even. They don't know what makes them feel good, what makes them feel bad. I feel like a lot of what I do is I reconcile people to their bodies, because I can kind of tell when someone comes in and they're like, yeah, I don't know, my body's doing that. Like, can you make it stop? Like as if their body is inconveniencing them. Like get with the program. And I'm like, okay, so let's imagine like you bought a sports car and a check engine light went on. Like, are you going to ignore it and drive it into the ground and be like, why is that sports car asking me for stuff? Your body, like your sports car is important, but like your body is your vehicle for your whole life. And so
Yeah.
it's really of the utmost importance to reconcile with your body, listen to it, speak to it, interact with it. Like you need to treat your body as like the most important thing in your life, really, because you can't get away from it. And if you would like to live like happy and joyful and free of pain, it really requires us to put our attention in our bodies and feel what does make us feel good. And of course, also eating for the right reasons, eating in the right mindset. Like if we're upset and depressed, and it doesn't matter if we're eating something nutritionally valuable, if we're upset or we're angry, then we're eating anger. And so I tell people sometimes when they have digestive issues, and we've tried a lot of things and nothing, it seems to be stubborn, it's not working. And then it's the idea of it's hard to digest our food when we're having a hard time digesting our life. That's an
Mm,
energetic thing. Like if life has been so unfair, has been so difficult that it's hard to digest, it's also hard to digest our food because our body's literally like, I can't digest what's happening in the world. I can't digest what's happening in my family. It's too much. It's too hard. You're very often there's also digestive issues are going to be flaring up at the same time. So yes, we help the body. So that's why acupuncture works because we release physical tension, we release emotional tension. We boost up the digestion of like, and we say sorry to it. We're so sorry we gave you all that ice cream last night. We know you hated that. That was really hard for you. I'm going to take care of you. I'm going to add in some ginger tea to offset the very cold dairy I just did. Those are the kind of tips I kind of give. Like if you're going to have a treat, but like pair it with something that's really helpful that will offset that because nobody wants to not do the fun things all the time. Like we have to have some type of moderation, but let's have our eyes open, know what we're doing, and then account for it and try to remedy it and keep balance. Balance is really what we're trying to do here with acupuncture because none of us can be perfect. And sometimes we don't even really understand what our bodies are doing, but understanding that our body wants to be in balance. Our emotions and
mhm.
our heart and our spirit, they all want to be in balance. So we're just working with the energy of the body, mind, and spirit to find that balance. And sometimes people just need a little help. They need someone to come alongside, hold their hand, help them out of whatever cycle they've been in. And that's what acupuncture is really good at that, is breaking you out of a cycle, especially the fight or flight cycle. Because when during fight and flight, let's remember that was just we could save our lives. Like let's say something's running, chasing us, trying to kill us. All of the blood and the chi go to our arms and our legs and our eyes so we can run and save our lives. Thank God we have that. But our society now, our culture now is that we're in fight or flight all the time. Deadlines, keeping up with the Joneses, the job, the vanity, all the things. And so what about our vital organs? What about our digestion? If all of our resources are in our appendages so we can run and save our lives, that means specifically our digestion is not getting what it needs. It's not making the blood that we need. It's not using the nutrients properly. So we have to go into parasympathetic, into rest and digest. Acupuncture naturally does that. That's what acupuncture does. That's how we break out of the cycle of people who are constantly in fight or flight and don't even know how to get themselves out of rest and digest. So while they're on the table, they get 25, 30, depends on the, but they get a big chunk of rest and digest and they like it and they want more of it. And so then I give them tools of how to do it at home. And I give them tools of, of course, we're going to be doing it here, but I want to teach them how to do it at home so that it doesn't only happen here. And the idea is that they're able to get themselves into rest and digest every day, even if it's just for a couple of minutes. And then they're going to realize this is amazing. I want more. And I'm like, yes, I support that you want more because all of your bodily functions are going to be better. Your emotions are going to be better. You'll be more balanced. Life is going to be better. You're going to be a better contributing member of your family, of your work, of your culture. This is why we love acupuncture.
Yeah, yes, it is. Yes, it is. So, a lot of people, especially in the Western world, where they've been raised in a Christian type family, and they're kind of closed mind to traditional Chinese medicine. Now, there is a link between us as creations and how Chinese medicine can help us as creations flow better. I know you as a believer as well. What is your response to that?
Well, it's funny that I feel like you caught my vibe. Like I was about to just say why Jesus would have loved acupuncture because of how I was just saying how it makes people's lives better. And I was going to say, I censored myself just a little bit because I was going to say you could be a better functioning member of your family, your work, but also your church and furthering God's kingdom, honestly. And so I want to write a book of why Jesus would have loved acupuncture because I get a lot of believers and some people even with church wounds or like semi-believers, but they say things to me like, I don't think God has time for me, or my issues are not that big. Like, I don't want to waste God's time. So I get this chance because they're on this table, they have needles in them, they can't go anywhere. So I'm talking to them about the truths of Jesus and how that's not true. There's an unlimited amount, like God is vast and God is there for you and cares about every little thing that you're going through. And so I do ask them, like, have you turned this over to God? Like, have you prayed about this? Have you surrendered this? And so I really believe that Jesus would have loved acupuncture, like based on, my study of his life. He was about rest. He wasn't about, and he was about not worrying, right?
Mhm.
And he was about like enjoying our lives. And I think that's really what he came for, was like, oh, all those things that are bothering you, like those don't need to bother you. Like you only have what you get for today. Let's do what you can with today. And my spiritual director in my life tells me corny things like God's address is NOW, like right now. And so it's like, what can I do today, right now, to help myself be better and really reach my fullest potential of who God wants me to be and how God wants to use me to further God's kingdom and bring peace and joy to the people around me and to the world. And so, yes, I understand that idea, that Christians are not sure. And so I personally am very sensitive to it and I let them know right away, like I'm a very hardcore Jesus follower. And I see no contradiction with Chinese medicine. In fact, I feel like it's very much aligned. Honestly, like if they had been at the same time, like would Jesus have even gotten acupuncture? Like maybe he would have been like, well, some acupuncture for everyone, or at least all his disciples, or for the ones who, I mean, he came for healing. Like that's what he was doing, was healing people. So how could it
Yeah.
not? Like like I help people who they've already gone through all the Western medicine, they've tried everything, and they don't have any answers. I can't tell you how frustrated people are when they are physically having issues, and the Western medicine they're like, we don't know. We tried everything. We tested everything. So the person now physically still has an ailment. Emotionally, they are beat down. Spiritually, they feel abandoned because there's no answer and they're suffering and they don't know what to do and they don't know why it's happening. They come in with a seemingly disconnected collection of symptoms. And then I'm like, oh, that's liver chi stagnation. Really simple, really easy. Let me show you in my textbook, literally all of those random symptoms. That's one diagnosis in Chinese medicine. They're always blown away by that their grouping of what seemingly random symptoms are actually on this list. Very often that's what happens. And so they feel like, oh, thank God, there's a diagnosis and there's a solution. And now I know what to pray for, what to pray about, and now I have hope. And once you give someone hope and they already have a faith, they can run with it. And it really works. And when they have faith that this is actually going to be the thing that helps them, it really does help them. And of course, I think when you feel good about your practitioner, when you feel like they actually care about you, which again, my source of love comes from Jesus. Like I'm just trying to show God's love through me to these patients. It's not really me doing it. It's really not me. Sometimes just recently someone came in and said, "Oh, I'm very upset. My brother-in-law has a condition and the Holy Spirit sent me subchorionic hematoma." I'm not even sure what that is. I'll be honest. It just came to my head. And she said, "Oh yeah, it's a subdural hematoma." And I'm like, that was very similar. And I've never seen this patient before. I have no idea what he had. I believe that to be the Holy Spirit sending me information. That was more of like a parlor trick. Like that didn't necessarily help me in the situation, but I feel like the Holy Spirit also does help me. Like I'll go touch a certain spot on their body with just not even, I'm just talking to them and I put my hand on their body, like, how'd you know it hurts there? Okay, God, I see what you did there, because I wasn't thinking. Whenever it bypasses my brain and I just do something, I just know it's the Holy Spirit and I welcome the Holy Spirit in, and then my patients get to feel it too. I'm very sensitive to people though. Like if they have a church wound, I don't push it, because I myself fell away for about 20 years and had a church wound. So I want to meet people where they're at and not worsen that feeling. For example, I just wanted to
Absolutely.
like give that as a caveat, because I don't force people. I don't force it down anyone's throat, because I don't think that's loving. I don't think that's what Jesus would want me to do. Instead, I just love them as well as I can and try to help get them the relief that they need.
Yeah, I absolutely understand that. And yes, church wounds can go deep, as I know from my own personal experience as well. But let's move on past that, and let's talk about, you know, there's so many people that are having issues with their lymphatic system, the detox pathways. Is that something that acupuncture can help with?
Yes, absolutely. It's actually interesting because we have like our main pathways that are all related to organs, like lungs, spleen, large intestine, stomach, kidney, all of those. We have another one. One of them is called the Sanjiao. Sanjiao, it's in the upper jiao, the middle jiao, and the lower jiao. So it spans the whole body, just like the lymphatic system. So it is said that I don't know how the Chinese 4,000 years ago figured out that there was a lymphatic system, but they knew that there was something that was doing something like what the lymphatic system does, and they decided to call it the Sanjiao. So there's no organ, but there is a channel. It's the only channel that doesn't have an organ matched up with it from the 12 main ones. And so we treat the Sanjiao channel, and it does what the lymphatic system does. It clears out, it moves out the toxins, it moves it from the different parts of the body. So that paired with lymphatic massage, it helps a lot. It's really amazing, actually. But in general,
Awesome.
acupuncture does that. Acupuncture detoxifies, it moves things out. I often invite people, if they haven't gotten cupping with big red cupping marks, I encourage them to take an Epsom salt bath after acupuncture. And the way that I describe it is that the needles have just done like they are controlling, regulating the immune response, but they're also like detoxifying like the cellular metabolism byproducts. And so I say taking an Epsom salt bath, it's kind of like we decluttered our house and put everything on the curb, and now we need like the Salvation Army to come by and pick it up. Like, and if we don't get it picked up, and that's what the Epsom salt bath does, is it draws out the physical, those little elements. And I'm a really big fan of Epsom salt baths because it removes physical tension, but also emotional tension. And I think it's really fabulous for detoxing.
I agree. I agree. And Dr. Wallach has mentioned that as well, with taking an Epsom bath to help with relaxation and just the power of the minerals themselves, the mineral itself, that is put into Epsom salts, that where it helps. Of course, he wants it to go in the body as well, with the plant-derived minerals and the 90 essential nutrients. But sometimes people's digestive systems are so jacked up that they need that extra help. And many times, like you've mentioned before, the emotional part of it, the spiritual part of it, it's real.
It is real. I have a specific you just jarred my memory about something. So like you had said, like let's say you're doing really great nutrition and yet you're not getting the results that you want. And so here's one of the very common pathways. If you look at the 5 elements, fire, earth, metal, water, wood. So there's the engendering cycle where they help each other out, but there's also the overacting and the controlling cycle. And so the wood element, if it's angry, if it's having a hard time, it beats up on the earth element. So basically the liver attacks the spleen in Chinese medicine. This is the most common presentation I see in women. It's so very important. So basically the liver in Chinese medicine is in charge of making the blood. It's in charge of moving the blood, not the heart, not the heart. It's the one in charge of bringing the blood all the way to the fingertips, all the way to the toes. So cold hands and cold feet means a stagnant liver that needs a lot of help, for example. It's also in charge of menstruation. It has a big role to play in reproduction. So anyway, when the liver doesn't have enough blood, we have blood deficiency because we had a bunch of babies, we breastfed, we bleed every month, maybe we bleed extra every month. We're not sleeping enough, we're not eating red meat, or we're not eating the things that we need to build blood. So then the liver kind of gets angry. I kind of compare the liver to that little guy in Inside Out, that movie. I love that movie because it's about emotional intelligence for children. And he's like this little guy, and sometimes he gets so angry, he lights on fire. And so I think I try to help people understand like your liver feels that way, especially with the emotions of anger and resentment and frustration deeply affect the liver. So any constrained emotion on top of life, menstruation, babies, all of this, again, it's very often women, the liver gets angry and it just starts beating up the spleen. So then you have bloating, you have indigestion, you have acid reflux, you have loose stools or constipation. And it's all from the liver. Or you get emotionally upset and then immediately you have indigestion, which is like the hallmark sign of IBS. We treat IBS really well because it's really just the liver kicking the butt of the spleen. So I use needles to calm the liver and boost the spleen. And I also have a very common, really powerful formula that calms the liver, offers it some blood, kind of like it's a really angry dog, and you're like, here, take some of this, like, and to have it stop harassing the digestion and then boost the digestion and you build it up so that it counteracts that terrible cycle that really, really hurts. It's a vicious cycle that then the digestion can't make more blood and the liver needs blood. And so you need acupuncture to break us out. I can't tell you how common this is, any age of women. And it's with like one treatment and one bottle of this formula, and it's life-changing.
Okay, so you mentioned women and childbirth and the menstruation. Let's talk a little bit about children. Is acupuncture, is that something that even children can utilize and benefit from?
Absolutely. We have a really fun time with children. I've actually needled a 2-year-old. The 2-year-old she was just lying there, really chill. I use tiny, tiny needles. I call them lightsabers. They're neon green. And I'm like, okay, we're gonna do lightsabers. And they're like, this is fun. So even just getting 4 needles in a child, that's enough. They're very thin, they're very shallow, they barely see them. They're very surprised about that. And even just that can do a lot for a child. But of course, there are children who don't want the needles, and that's fine. We can do acupressure. I use ear seeds it's a little seed on a little band-aid, and I stick it on their body. That can help. That can be really effective as well, because of course the kids' chi is closer to the surface and it's moving faster and it's like ready to respond to whatever stimuli we give it. The other thing we use is I have an electrostimulation machine, but instead of connecting it to needles and having it jiggle the painful areas, usually the glutes, I'll put it on a facial probe. And so then I just put it on their skin. So it's an electric current, but there's no puncturing. So they might feel a little zapping, but just a little bit. We call it the tickle machine. And so that's another way to do it. And of course, there's cupping. I use a silicone cups with the kids, and I like to teach parents how to use the silicone cups. Like when your kid has a fever, you cup them right in this upper area because all the heat is going up. And so if you cup here, they're like, oh, I feel better. And then they can take a nap, which is what you want them to do. So the body can keep fighting off the infection, right? We also have pediatric herbal formulas that are in glycerin instead of alcohol. My kids have been getting those since they're about 6 months old. The kids don't mind them, they're used to them. So instead of being sick for 3 weeks, my kids are sick for 3 days. As soon as there's an onset, we do the cupping, we do the ear seeds, we do the pediatric formulas, and we change the food. This is one of the most important things I like to tell everyone is whenever you have phlegm or your child has any type of phlegm, the nose, the chest, anywhere, you have to cut out all dairy. You have to cut out all citrus. People are like, what about citrus? I thought orange juice is healthy. Not for phlegm. It makes more phlegm. I have personal experience with this. I was born very ill, extreme asthma, extreme allergies. And I remember my doctor dad and my nurse mom had no idea what to feed me. And so they'd give me big glasses of orange juice. And so I would drink it. And then I'd be like literally drowning in phlegm. And so, and I tried it. I tried it out as an adult. I'm like, it really makes a difference. And I can see it in people, even if they have residual phlegm and I see them eat dairy or drink citrus, it creates more phlegm. And usually when parents come, they're like, oh, my kid's so sick. Have you cut out dairy and citrus? no, they're having orange juice right now. And I'm like, you have to cut it out. This is one of the most practical tools, practical tips that I want to give everyone for themselves and for their children. And so, yeah, Chinese medicine works really, really fabulously.
Awesome. Well, we only have 15 more minutes in the show. We've got some hands up. Let's go ahead and jump over to some questions. And AJ, what question do you have for Elizabeth today?
A number of questions. Elizabeth, thank you for being on the show with us. Just as far as the orange juice, we don't drink our sugar. So that, the citrus, lemon water might be a little different, but there's no sugar in lemon water. But I can actually recall giving my cousin some Tangy Tangerine, which is our flagship product. And upon him drinking the Tangy Tangerine, he stopped sneezing. He went back to drinking his sugary iced tea, and he's and sneezing. And I'm like, you did notice that when you drank the Tangy Tangerine, you weren't sneezing. He said, oh, that didn't happen. And I'm just like, okay, we don't drink our sugar. So that's the point I wanted to make there. My question is, I see some kidneys behind you on the wall. I hope it didn't hurt the person you took them from. But I have someone I'm working with who's having trouble urinating. And this gentleman mentioned to me, I don't work with, what do you call these things, Becca?
Essential oils.
What do you call that person that does the essential oil thing?
Aromatherapist.
Okay, I'm not an aromatherapist, but he mentioned to me that when he used, I forget which one, the one that makes you sleepy, I think maybe.
Lavender.
He used lavender. Or it was one of them. He was told to rub it on his kidneys. He rubbed it on his kidneys, and he was able to urinate.
Interesting.
But he's looking for some solutions. Is acupuncture something that will help him, that could potentially help him in addition to the herbal formulas, etc.?
Yes, absolutely. My first question is, how old is he?
He's got to be in his 70s.
Yeah, so if he's in his 70s, he probably has benign prostatic hyperplasia. It's probably his prostate is probably enlarged, and it's pressing up against his urethra or his ureter. That's generally what it is. But yes, acupuncture can help with, if that's what it is, because it very often is. It can help with that. It can help shrink the prostate. We actually needle. We needle all over the body. So if we need to, we will needle the prostate obviously through the skin. And we treat the urinary bladder channel. It goes down the leg, and the kidney channel. And so we would want to see if there's any blockage. So there can be blockage of qi. There can be actual physical blockage, which I talked about with the prostate hitting up against it. He really does need to get that checked out. Of course, we know that there are herbs and supplements that help with prostate issues. And Chinese medicine has specific formulas that, in case it's already enlarged, to take it down. And then to make sure there's a good flow. And also just boost the kidney function in case there is an actual kidney issue. That we have different ways of diagnosing that, whether there's heat in his body or cold, or if he has, well, I won't go into all those details, but I would need more diagnostic tools. But the answer is yes. The answer is absolutely yes.
So I should tell him to call you and allow you to stick a needle in his prostate. Is that what you said?
Well, no.
That's not great.
I mean, I've done it. I work on all parts of the body, and so we whenever it needs to happen, that's what we do.
Thank you very much.
If it's going to help, it's totally worth it.
Awesome. Great question. Thank you so much, AJ, as you opened up another area that acupuncture can be beneficial for. Let's go on over to Phyllis. I think Phyllis is next. Yep, Phyllis. What question do you have for Elizabeth today?
Hello, Elizabeth. I'm really enjoying hearing how you work with your clients, you know, the actual things that you do. And also, you've talked a lot about how you make suggestions to people so the treatment will be more effective. And I wanted to hit on the nutrition angle for a minute. I have a client, the cats are all over me. I have a client who has had acupuncture for arthritis and including cupping, and it was not effective. And so he wasn't accessing the potential of that therapy. And when he had a food sensitivity blood test, we found that he was eating foods considered good foods every single day. He was eating eggs and almonds and tested sensitive to that. So I just want to put it out there. Can people go back and retry these therapies now that they've paid attention to that area? I can comment on that.
Yeah, that's a really good idea, because I think what you're saying is that he was eating something that is seemingly healthy, but wasn't healthy for him. And so it could have been causing some type of like immune response, allergic reaction in him that the acupuncture may not have been able to overcome. Is that correct?
Yes.
Yeah. And so, yeah, so if he was able to figure out that he is sensitive to that, I mean, of course, I would hope that his symptoms are already getting better from not taking something that is irritating to him. And then the acupuncture would be able to be more effective if there's not other things counteracting it. Not to mention, acupuncture could take more than one session to feel a difference for arthritis. I'm assuming we're talking about osteoarthritis, the wear and tear type of arthritis, not
Yes.
rheumatoid or anything like that. Yeah.
It,
And
it
so,
was osteo, and he actually had a series of 12 treatments, including
oh, and
cupping.
still,
And
oh,
maybe he didn't get the trash taken out after the cupping was
hmm.
an issue also.
Interesting. Well, it's hard to say, because I like to assume that all of us acupuncturists are basically doing the same thing and able to really help our patients. But of course, that's what I come up with. I was like, what was the acupuncturist doing, and in what way? And were they needling correctly? And did they have enough time with the patient? And there's lots of questions that I have. Did they diagnose it properly? Like, were they hitting the right points? And so, because that's unfortunate that he went for 12 sessions and still didn't feel a difference. But I would say yes, but I would also say try a different practitioner,
That's what I'm
because
thinking. Yes.
sometimes that's it. Because I hate to say it, but I've seen people treat other practitioners try to treat pain, and their needling is, I'm like, that's not that's not what I would do at all. You know,
Mhm.
like, I maybe because I was an athlete and I've been in pain myself, I'm like, no, we're gonna get at that. We're gonna go deep. We're gonna, as long as the patient's fine with it, like, I really want it to be effective. And so, and sometimes we go from the front, we go from the back, we go from the side. Like, within those 12 treatments, after the first one, if he didn't feel something, I would have changed it. And then if the second time he didn't feel something, I would have again changed it. I
That's
would
what
keep
didn't
changing it.
happen. That's what
It
did
did or
not
didn't?
happen. Did not.
Yeah.
He did the same thing over and over
No.
again.
Mm-mm. Here, I mean, here's an example of that. Like, women, again, I do specialize in women. I treat men. Men are kind of easier. That's why I talked about women a lot, because they're a little complicated. I'm treating their low back. I'm treating their low back. I'm treating their low back. Nothing's happening. And then it's finally like, how many babies did you have? And did you have the diastasis recti? Did your muscles in the front of your abdomen separate? Did you ever get that diagnosed? No, I have no idea what you're talking about. We need to go to a pelvic floor therapist. Do you have urinary incontinence? Oh, yeah, it's terrible. You have diastasis recti. That's why working your back hasn't been working. You have a separation in your abdomen. And so your low back is holding on to the abdomen like this, but it's because it's not met here. So you have like a physical issue, and you need a pelvic floor therapist. Or, I mean, some people actually get the surgery and have it sewn back together, which the results are amazing for that. But but that's extreme. And at first, we need a pelvic floor therapist to work those ab muscles back. Otherwise, I can needle you from the back forever, and nothing's going to happen. It's not tension, it's weakness. A lot of times people think it's tension. This isn't tension, this is weakness. Or there's an asymmetry from right to left or front to back that we need to correct. We need to stretch the front and we need to strengthen the back, for example. And people think this is tension and it's too strong. It's not strong. This is strong. From computers and phones and driving, this is what's strong and it's pulling, and this is weak. This actually needs to be stretched. and the back needs to be strengthened. This is just an example of how we have to keep looking at it in different ways. And if you're not getting results from acupuncture, you got to try something else. And you have to try someone else.
Yes, don't give up, in other words, and seek that balance that you're describing between what needs to happen. I do have a question. You had mentioned using electrical stimulation of needles, and I'm familiar with how chiropractors can use dry needling with electrical stimulation, but what you're doing is a little different. Can you tell us how it's different from that?
You know, that's interesting. I don't know if I knew that physical therapists are actually using the electrostim with the needles, because and actually, if I'm correct, that is what I do. So the physical therapists are basically borrowing an acupuncture technique. Some of the acupuncturists were upset about this, which is kind of understandable. I choose not to be upset because I'm just glad people are getting relief, and they just have the tiny little bit. They know how to find the tension, put the needle in, try to release it on a trigger point. I'm guessing they're attaching the electrostim like with an alligator clip, like I do, to
Yes.
the needles, and then you ramp it up on the electric current, and then it starts, depending on where you're at, it can jiggle. The whole thing it's jiggling out the tension. So that is an acupuncture technique that the physical therapist, let's go with borrowed, adopted, and now charge for it. And acupuncturists, we tried to fight it because it's really, that is in the realm of acupuncture. But you know what they can't do? They can't regulate menses. They can't help with fertility. They don't know how to promote natural labor. They don't know how to deal with menopause or oncology. They don't know how to do that. They don't know how to calm the mind with the needles. And so, great, they can help with pain, fabulous. We still do all of the other things on top of helping with the pain.
Thank you so much, Elizabeth.
You're welcome.
All right. Thank you, Phyllis. And thank you, Elizabeth, for that amazing insight and input. And Marilyn, what question do you have for today?
I'm okay. I had carpal tunnel for a long time. I do a lot of typing, and we had talked a little bit before the show that I had gone to an acupuncturist and they worked on my ankles, the outer ankles, and I went into like a seizure. I kept kicking for I would say it was like at least 2 minutes straight. They couldn't get it to stop, and they said it's just normal, let it pass, and it did. And acupuncture just really helps with my carpal tunnel. It disappears if I do regular treatments on an ongoing basis, definitely. What I did have a question about though is I've gone to them I lack my sense of smell. Is there a way that the acupuncturists can help with that? I've been told that they can't. What's your take on that?
Yeah, that's a challenging one. And I feel like it's actually, I don't know if it's new because of COVID taking away smells or not. It's new to me. Like when I was in acupuncture school, I don't ever remember them teaching us or talking to us about, oh, this is how you regenerate the sense of smell. That was not something that I think they taught us. So as much as I like to say we treat everything, I treat the nose, right? Like if people have nose, nasal congestion, whatever, like we do the yin tongue here, we do the bi tongue here, we can open. So we can physically open the passageways, and we do the Li4 because it's the command point for the whole head, for example. And I know how to draw phlegm out of the head if it's affecting the ears or the nose. So there are things that we can do. Those are probably the things that I would do in order to set the body up to restore the sense of smell.
And then
The actual
after doing that, someone said that they do feel it's being
unfortunately,
restored?
unfortunately, I don't have a case study where that has occurred. I was kind of just letting you know, if a patient came in and told me that, which they have, I try all of those things. Have I actually restored the sense of smell for sure with a patient from acupuncture? I cannot say that I have successfully done that yet. And I think it's a question for some of my teachers, for some of the masters, to see if it's even possible, because as far as I can tell, it's a new issue. It wasn't something that was so common before the COVID loss, side effect of loss of smell. I wish I had a better answer for you,
Right, and
Marilyn.
it seemed to be around COVID when I had a lot of more congestion. Yes, and then now it seems like I haven't gotten it back.
It's interesting, because when I when I don't think acupuncture can help, or if I try everything with acupuncture, I try everything with the herbs, then I move on to like, what's next? What else can we do? Is there manual manipulation? Can, like a roll for example, like they're going to go in the mouth, maybe in the nose, maybe in the ears. Like, is there something manually that can be done? Can some type of energy healing be done? Is there a desensitization process using the olfactory system? Those are just some thoughts. So when I have a patient who comes to me with something that I don't have an answer for, I just pretend like it's me. And then I blurt out a bunch of things like I just did. I'm like, well, maybe we can think about this, or let's do research here, or maybe we can find someone who has the answer, right?
Well, it's
Because
good that
if
you
I don't,
say that, because in the past they've just say, we can't help you with that. Just a
you know, I
flat out.
just had this, I just heard this, Marilyn, recently. I had a patient come like from an hour away. Someone told her, like, you have to come see her because her acupuncturist said, oh, you have tinnitus. Good luck with that. She did not like that response. And I said, I disagree. There are two types of tinnitus. One is high pitched, one is low pitched. Low pitched, okay, fine. It's very difficult to treat. It's usually the person's very old, or they have damaged their ears from being like aviation or job or something like that. But high pitched, that's the liver. We can treat that. We can absolutely treat that. So I felt bad for this patient. She came all the way to me for me to say, like, no, your acupuncturist is misinformed. Maybe a little bit jaded, and that's not helpful. There are a bunch of reasons why she's having ringing in her ears. It's not just the ringing. Let's treat every single thing about her, and hopefully that will also get better. But to just say like good luck with that, that's not how we treat patients. That's not what we say.
Wow, maybe I'll send some of my clients your way. Thank you.
Well, and you know, Marilyn, you're close enough. You could go see her as well.
Well, the funny thing is, it's like, hey, maybe I can't specifically treat the one thing that you're talking about, but can I make your sleep better and your digestion better? Are you going to be happier? You know, like, is your poop going to get better? Like all of the different things. And we just treat one thing after another, and then people's lives get better. And they're like, oh, I feel better, having a better time in my life. I don't really think I need to come see you.
Well,
Great.
yeah,
Send me your next friend.
I remember overall when I had like 12 treatments in 1 year, that was I was good to pay for. But anyway, the whole energy, everything changed. The sense of calmness changed. Definitely, that was one thing I really noticed.
It really does. I love my maintenance friends, like 12 sessions in a year, that's one per month. Fabulous. Do that. Think of all of the things that you might be preventing when you're doing that. And you just have a check-in with someone that you trust, with someone who knows, cares about you and knows you at least a little bit. And if anything starts creeping up, no, knock it out with this. Go try that. Go do this. And then they're like, oh, okay, good. And they feel like they have someone on their side, on their team, as opposed to just like, oh, life is kind of not great. And it just like gets worse and worse and slips through their fingers.
Well, I
That's
think
not the
about
way to
my
be.
ankles. When I think about my ankles and what they probably unblocked, why that occurred, I have no idea. Because I didn't see any swelling or anything in my ankles, nothing. But there was a lot of blockage apparently.
That's fascinating. And it could be, I mean, because we're working with electricity in the body, we're like mechanically, we're vasodilating. We are, you know, opening up those spaces, and we're regenerating nerves, and we're working out. Maybe the nerves are all bundled, and we're like, that got worked out. Yours were, for some reason, they were kind of like misfiring, possibly. And then you got all of that frenetic energy out, and then it was able to be smooth. We just want smooth and calm all the time. We don't want crazy anything. We just need to smooth it out. That's what it sounds like what
I
happened
was
with
like
yours.
freaked out. The therapist like knew this happens like all the time or something more common, but I was
Had that. I mean, I would like to see that, because I've not seen that exact thing happen, but that sounds fascinating. But weird things do happen, and they're like, it's better. I'm like, yeah, I planned that. Sure.
okay. Thank you. Appreciate you.
You're welcome. Mm-hmm.
Awesome. Thank you, Marilyn. And AJ, come on back.
Yeah, so as far as tinnitus, you know, Dr. Wallach tells us how to deal with tinnitus. And, you know, the first thing I noticed when I started taking the longevity nutrition was my sense of smell got very sharp. And in fact, that was something that this was pre the C word was a thing. So, you know, the osteoporosis of the skull, which is what Dr. Wallach talks about, squeezing any one of our 12 pairs of cranial nerves, will, you know, can affect us in other ways. But my my question is, I tell Becca all the time that she should go see a Tuina person. Do you agree that Tuina might be beneficial?
I love Tuina. I have done Tuina. Like it's medical Chinese massage. It's not relaxing necessarily. It's not like with oil. It's mostly with the hands and the elbows, and there's some rocking. It is fun. So in China, when you have an ailment, first you go get nutritional advice, and they might give you a bag to make the congee. And then if you have like a physical thing, then you go to massage. And only then do you go to acupuncture. Acupuncture is like for like the big issues, but massage is actually part of the medical system. They have massage therapists in the hospitals treating issues. So I think Tuina is great. It's like, for example, you have a knee issue. They're going to work. It's called rolling, and they use their hand, and it kind of is like this. You're using this as like your knife's edge. That's a lot of what we do. And yeah, it can work out the tension, and they're going to follow the channels. Very much like acupuncture. It's just that the therapist is working way harder than using needles. But I love Tuina. It's definitely part of Chinese medicine, and something that I use occasionally, especially I use some elbows here and there, but I'm also trained with other massage and shiatsu and all of that. So any combination is great.
Which one's the best?
That's a good question. I think they're just different. I like the how Tuina is very, it really gets into right where the areas are, whereas shiatsu, it's working more with the pressure points. And so you're kind of like, why are they randomly pressing on the side of my body? But then afterwards, you're like, I feel amazing. So it's a little bit more esoteric, I would say, the shiatsu. And Tuina is like, oh, you have problem there? We get it. So we go for it. We're very direct.
That sounds painful. That sounds really painful.
No, yeah, Tuina is way more painful than getting acupuncture. It definitely is. It's easier because when you have the pressure that you'd have to use on a point that you could just insert a needle and pop that trigger point, like your whole muscle fasciculates when you really get the right point. That's nothing compared to what you'd have to do with your elbow and get that little point in. So people who don't like that, acupuncture is a better idea. If you like the pain and you want to get really worked out, then go to Tuina. But you're gonna have to find a big, strong person for that Tuina. It's not easy to give Tuina, is what I'm saying. I feel sweaty just thinking about it.
It sounds a little bit like infrastructural fascia release, not fascia release. Release is not the word, but yeah, I've had that a couple of times, and you feel so good afterwards.
Yeah.
I learned that I laugh at pain, where some people like scream and cuss. I just laugh. But
I laugh too. I mean, sometimes I cry, but I laugh because it's just an energy release. Like however we can release energy, we need to release it as much as possible. I tell people that a lot. Sometimes they cry. That's a release of energy for the liver. Tears are the fluid of the liver. But even just laughing, sighing is also helpful for the liver. But laughing is for the heart. It gets out the heart chi. It boosts it. So all of those reactions are helpful and positive. We just need to keep things moving through our bodies, whether they're physical or they're emotional. If they get stuck, they cause problems. If you keep them moving through, much better.
awesome. Fantastic. And Olga in England loves Thai massage herself. Well, let's go up to Albert, and this will be the last question of the day. Thank you so much, Elizabeth. Albert, what question do you have?
Hi there, Elizabeth. Thanks again for being on the show with us. But what I wanted to find out is it's a bit far for me to pop over and see you. So if I wanted to see someone, a good acupuncturist here in South Africa, what would I do to find out, or who is a good acupuncturist or not?
Yeah, that's a great question, Albert. I wish maybe I can just fly to South Africa to come see you.
Yeah, come on
That
over.
sounds fun.
I'll go with you.
Okay, let's just go. We'll go surfing. There's one website that I know of. It's called AcuFinder, AcuFinder.com. I'm not sure if it's international, to be honest. I
Okay.
personally, I mean, I could personally like reach out to my professional group or possibly LinkedIn. LinkedIn, you might be able to find it as well. 'Cause that's more international. I wish I had a better answer for that question. And I'm trying to think of if I know anyone who is in South Africa. I had a colleague who was from South Africa, but I don't know if she went back or not. So I kind of want to double check for you and get that information to you if I can find someone.
No, but that's great. Thanks. Because you did say that there are times where you're going to have to move and get to another one. But even for those in America, not
True.
everybody would be able to just get over to you. And it's finding somebody good as opposed to doing a hit
Absolutely.
and miss all the time.
It's it's not a perfect system. I hear what you're saying. The
Okay.
AcuFinder plus, then there's my college, and my college has 3 campuses. It's called Pacific College of Health Sciences, and they have a San Diego, a Chicago, and a New York. And so going to them directly and possibly asking them for a referral list, or going to the, if anyone's close to those schools, going to the schools and seeing the instructors, then that way you can learn more and maybe try out a couple of different modalities, different types of acupuncture, to find out what you like, and to get a referral list of their graduates, because I feel confident about graduates of our school.
Yeah.
Fantastic. Well, and
Thank you.
Albert, there may be a school there in South Africa that you can go and visit. But folks, I just want to say thank you, everybody, for jumping in and being part of today's program, plugging in. I hope that you learned something that you can take away in having some outlets to help with the emotional, the spiritual, with the flow through the body of the blood that then helps the body itself be able to do what it was designed to do. Now, just a reminder, this program is for educational purposes only. It is not meant to take the place of your primary care physician, nor is it meant to treat, diagnose, or cure any disease. But folks, when you give the body what it needs, the body itself can do some amazing things. This program is being sponsored by dailywithdoc.com. We invite you to go check out the articles that we have there on the website. We also have information about Dr. Wallach, his philosophies, the good foods, bad foods list, which, like Elizabeth said, she takes out gluten first. Dr. Wallach is definitely not in favor of gluten, as it is a protein that our bodies have a hard time digesting. Now, Elizabeth, you are part of South Bay Family Acupuncture in the San Diego area, Bonita specifically. How else can we get more information, or do you have an outlet that people can go and get more information just to empower and enlighten themselves? Do you have a YouTube channel yet?
I don't have a YouTube channel yet. I'm working on it. So, well, for a little personal side note, I just went through a 3-year high conflict divorce, but I'm divorced, praise God. And so I am about to launch everything. I'm working on getting that. I had to take care of that first, and now I'm ready to launch and do all of that. And so stay tuned is what I have to say about that for now.
Awesome. Well, I hope that you are, you may feel free to use this video as one of the first ones for your YouTube channel. There you go.
Wonderful.
As
Appreciate it so
we
much.
introduce you. And how, if people have any information or any questions, now, folks, I don't want you to think you can just call Elizabeth and get a bunch of free information. But Elizabeth, is there anything that you are able to offer? Any articles that you've written that we might be able to send to our subscribers that has your information on it as well?
I'm gonna think about that. I might have something that I co-authored. I'd have to check, and I could share that. But I actually don't
Awesome.
mind getting some emails, and I will respond to them as soon as I can, and just kind of give people a little bit of information or referrals or references or anything like that. I'd be happy to do that.
Okay, well, folks, here is her email address. SB as in boy, as in Frank, ACUPUNCTURE@gmail.com. Again, that's SBF Acupuncture @gmail.com. Thank you so much, Elizabeth, for all that you have contributed to our community. Greatly appreciate you, and I look forward to speaking with you more and helping you in being more out there, spreading your wings and doing what you've been called to do.
Thank you so much. You're welcome, and thank you for having me, everyone.
Well, thank you, thank you, thank you. And I just want to do a thank you also to my co-host team for today. We've got Albert down in South Africa helping to let people in. We have Phyllis out pulling the information, questions, bringing them in from the different platforms we have. And she's also doing a lot in the chat as well. We have Marilyn who's doing transcription, putting information into the chat, and we have AJ bringing in questions and keeping an eye on things out in the different social media platforms. Also, thank you everybody for being part of this community as you are investing time in yourself so that you can then help yourself, your family, your community, and together we can help make a healthier world all the way around. Until next time, thanks everybody for joining us. Oh, AJ, do you have Ben Bites next week?
We do have Ben Bites on Monday. I'm not sure what time.
All right. So folks, make sure that you go to our website, dailywithdoc.com, sign up for that email list so that you can get email notifications of when we are live and when our programming and information about our programming that's coming to you. Until next time, bye for now. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health. Dr. Joel Lawley. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health. Dr. Joel